Indicators of health, simplified notes. What are indicators of health? Indicators are signs or tools that help measure the health of a community. They are used to compare health between countries or regions, find out what health care people need, plan where to spend resources, check if health programs are working. What is a health indicator? According to WHO, it's a variable that shows change in health. Example: infant mortality rate tells us about the health of babies in a community. Indicators help track progress over time and compare between groups or areas. Health indicator versus health index. Health indicator equals single measure, e.g., life expectancy. Health index equals combination of several indicators, e.g., physical quality of life index. Characteristics of a good health indicator. An ideal health indicator should be 1. Valid, it truly measures what it is supposed to. 2. Reliable and objective, gives the same results if repeated by different people. 3. Sensitive, detects small changes in health. 4. Specific, reflects only the condition being studied. 5. Feasible, data is easy to collect. 6. Relevant, useful and meaningful for understanding health. Note: in real life, very few indicators meet all these qualities. Why measuring health is difficult. Health is like happiness, hard to measure exactly. People may feel healthy even with a disease, or unhealthy without any clear illness. So, we often measure health by looking at illness, morbidity, disability, death, mortality, social and environmental factors. Health is multidimensional. Health has many parts: physical, mental, social, etc. So, we use many indicators together to get a full picture of health. This collection of indicators is called a health profile. Types of health indicators. 1. Mortality indicators, related to deaths, e.g., death rate, life expectancy. 2. Morbidity indicators, related to illness and diseases, e.g., incidence, prevalence. 3. Disability rates, related to limitations in normal activities. 4. Nutritional status indicators, show nutrition level, e.g., child growth, weight. 5. Health care delivery indicators, show health service availability, e.g., doctors per population. 6. Utilization rates, how much people use health services, e.g., immunization rates. 7. Social and mental health indicators, include suicide rate, alcohol use, etc. 8. Environmental indicators, access to clean water, air quality, sanitation. 9. Socioeconomic indicators, income, education, employment. 10. Health policy indicators, government spending on health. 11. Quality of life indicators, overall well-being, e.g., PQLI, physical quality of life index. 12. Other indicators, from WHO, UN, and ILO related to health and human development. 1. Mortality indicators, show death-related health data. Crude death rate, number of deaths per 1,000 people per year. Gives a general idea of health status. Life expectancy, average years a newborn is expected to live. Higher life expectancy equals better health. Age-specific death rate in a particular age group, e.g., 20 to 24 years. Infant mortality rate, IMR, deaths of babies under 1 year per 1,000 live births. Key indicator of overall health. Child mortality rate, deaths of children aged 1 to 4 years per 1,000 children in that age group. Under 5 mortality rate, proportion of deaths in children under 5 years. Adult mortality rate, chance of dying between ages 15 to 60. Maternal mortality rate, deaths due to pregnancy-related causes per 100,000 live births. Disease-specific mortality rate, deaths due to a particular disease, e.g., cancer. Proportional mortality rate, percent of deaths caused by a specific disease out of total deaths. Case fatality rate, percent of people dying from a specific disease among those diagnosed. Years of potential life lost, YPLL, years lost due to early death, e.g., dying at 30 instead of 75 equals 45 YPLL. 2. Morbidity indicators, show illness and disease data. Incidence, new cases of a disease. Prevalence, all existing cases, old plus new. Notification rate, rate of reported cases of notifiable diseases. Hospital data, OPD attendance, admissions, length of stay, readmissions. Sickness absenteeism, days missed from work, school due to illness. 3. Disability indicators, show limitations in daily living due to illness. Event type, days of restricted activity, days in bed, Work, school, lost days. Person type. Mobility issues. Difficulty in daily tasks, e.g., eating, dressing. 4. Composite health measures. Health adjusted life expectancy minus years lived in poor health. QALY quality adjusted life years combines life length and quality. 1 QALY equals 1 year in perfect health. DFLE disability free life expectancy expected years without disability. Daily disability adjusted life years total years lost due to illness, disability, or early death. Daily equals YLL years of life lost plus YLD years lived with disability. 5. Nutritional status indicators. Child weight and height. Low birth weight rates. Mid-arm circumference. 6. Health care delivery indicators. Doctor to population ratio. Nurse to doctor ratio. Beds per population. Health sub-centers per population. Traditional birth attendance per population. 7. Utilization indicators. Shows how people use health services. Percent of fully immunized infants. Percent of pregnant women with antenatal care. Percent using family planning methods. Hospital bed occupancy. Average hospital stay. 8. Social and mental health indicators. Suicide, homicide, crime rates. Alcohol, drug abuse, smoking, obesity, domestic violence cases. 9. Environmental indicators. Access to clean water and toilets. Pollution levels air, water. Waste disposal and sanitation. 10. Socioeconomic indicators. Population growth rate. Per capita income (GNP). Literacy, especially female. Employment and housing conditions. 11. Health policy indicators. Percent of national income spent on health. Percent spent on related areas water, sanitation, nutrition. Percent spent on primary health care. 12. Quality of life indicators. Measures physical, social, and emotional well-being. Includes physical quality of life index. Infant mortality, life expectancy at age 1. Literacy. 13. Other indicators. Social indicators UN education, income, safety, housing, etc. Basic needs ILO food, water, doctors, disease rates. Health for all WHO. Policy indicators. Economic indicators. Health service access. Health status IMR, life expectancy, etc.